Good afternoon, everybody. We'd like to welcome you to our Facebook Town Hall. I'm County Executive PJ Wendell. We apologize. We are trying to get online with Facebook. We had tried this prior, and we are getting a error on the end of Facebook. So we apologize. We're recording. If we are able to live stream, then we will have that up and running. If not, you'll be listening to us recorded video. With me today, we'll go over many of which are my COVID-19 response team. With us today is our public health director, Christine Schuyler, who's shared the microphone and video with me on several of our press conferences. Also, we have Dr. Burke, our county health physician. With us also is Dr. Brian Walters, another one of our county physicians. We also have Brienne Eggett, yes, from our public health department, and she is our epidemiologist. With us too is John Griffith, Director of Emergency Services here in Chautauqua County. We also have Dr. Michael Falk, another one of our county physicians, who is with us. And I believe that's it. We do have Kendra, our interpreter for our deaf and hearing impaired. We do like to note that Chautauqua County was a community partner for the deaf services here in Western New York. So thank you to them for acknowledging our work with them. And thank you for providing the service for us and residents of our county who are hearing impaired. We're doing this today to get a messaging out to all of our residents as we prepare for the holiday season. As the numbers are starting to increase across Western New York and the region, we do want to make sure that we are clear on the messaging and transparent and dispel any questions that might have arisen. We know Western New York is increasing, Erie County especially, and we just want to remind everyone what we're faced with. Starting out, I would like to first of all thank everybody for all the work they've done. We have done a great job in Chautauqua County thus far. The latest statistics are a positivity rate of 1.4% here in Chautauqua County, which is remarkable. So as many would say, well, we're still seeing many people without masks, many people not following the guidance. If we get a small percentage of those people who we feel are not following the guidance, think of where our numbers could be, and that could be much lower. So we do appreciate everybody's efforts. We're not through this yet. We're in this together, and we need to continue to work, especially through the holidays. And as we said from the very beginning, we don't know who this will affect and how it will affect them. Some people think that if we're young and vibrant, we'll be able to bounce right back. We're seeing that sometimes that isn't the case. And some of our elderly population who we found are our most vulnerable have bounced back, but still not always the case in some. So we do want to remind everyone to continue their vigilance, continue the hard work, and we will see ourselves through this on the other side. At this time, we're going to turn this over to Sheriff Jim Quattrone, who's going to talk a little bit about enforcement here in Chautauqua County. Sheriff Quattrone.
Thank you, Mr. Wendell. First, I'd like to echo your comments and thank the public for being so diligent overall in wearing face coverings and practicing the precautions that have been recommended to keep the spread of COVID as low as we can. We will continue as a county, the sheriff's office, along with the police chiefs and the state police, who we've all been in discussion, to continue to encourage and educate people to follow the precautions. One of the things that we continue to say is that we will not enforce anything that's a violation of constitutional rights, but we will continue to encourage people to do that and remind people that we all have rights. We will respect those rights, but with every right that we have responsibility also. And that responsibility now is to keep our neighbors, our friends, our families safe. And this isn't the time to get lax when it comes to the precautions. So we continue to encourage people to wear the face coverings, if there is a problem that they're seeing, that they can report that. It does help if we know who's reporting so we can follow up on different cases. But again, stress that overall the community has been very supportive and cooperative as we reach out to, when we get a complaint, we reach out to those who are possibly in violation. They've been understanding and working with us to follow the proper guidelines.
Thank you, Sheriff. Next, we're going to go over to Brienne Eggett, our epidemiologist, for some of the information she has to share. Bree.
Hi everyone, I'm going to share my screen and show you some recent statistics that we're starting to take a look at here. And can everybody see that? Uh-oh. So through yesterday, November 16th, we have a total of 1,348 COVID-19 cases in Chautauqua County. Of those, 147 are currently active, and we've had a total of 15 deaths so far. We've also had 1,186 recoveries. So those numbers result in a case fatality rate in our county of 1.1%. So 1.1% of people who had COVID-19 in Chautauqua County have passed away, and that's compared to 5.7% at the New York State level. Our current active case rate is 115.8 per 100,000 population. So for every 100,000 people in our county, there are 115 people who have been positive, who are currently positive for COVID-19. In total, over the course of the pandemic, 1.06% of our county population has tested positive for COVID-19, and there have been 71,410 total negative tests for a cumulative percent positive rate of 1.87%. As of 2 days ago, there were 7 people currently hospitalized in Chautauqua County hospitals. So this is a snapshot of what COVID has looked like in our county by month. So from March through November, you can see that the gray, what you see in gray, are those who have recovered. The blue are active cases, and the orange, which fortunately are pretty small so far, are deaths that we've seen. So there were 2 deaths in April, 3 in May, 2 in June, 2 in July, 3 in September, 2 in October. And you can see that the case rates have generally, with the exception of June where we saw a slight decrease, have generally increased over time by month. And we expect to see the cases for November exceed those that we saw in October. And as we put out in a press release in late October, at that time, October was most definitely the toughest month of the pandemic for Chautauqua County. And we see that getting worse. So when we take a look at cases by age group, you can see that the overwhelming majority of cases were in those who are aged 20 to 29. Lower numbers among our youngest residents and our oldest residents. And it's about half and half male female when we take a look at the sex of the cases, about 57% female and 43% male. So slightly higher among females, but not an overwhelming number. So next we have the COVID-19 deaths by age group. So taking a look specifically at those deaths that we've had, those 15 deaths, how old were the individuals? We had 5 between 85 and 89, 3 between 70 and 74, and 2 between 60 and 64. Those were the most common age groups that we've seen so far. No deaths to anybody under the age of 45. So if we take a look at the case fatality rate by age group, you can see that it's pretty significant among those who are ages 85 to 89, about 15%, which, you know, doesn't make anybody in that age group feel comfortable. So 5 out of 33 total cases have passed away. For those ages 70 to 74, 3 out of 44, resulting in a case fatality rate of 6.8%. But generally what you see, there's been some exceptions here, but generally the older the individual, the higher their risk for dying as a result of COVID-19. And that's not intended to be alarmist, but it's just a reflection of the truth in what we're seeing here in Chautauqua County. So our elderly residents are certainly at a greater risk of dying as a result of COVID-19. And I have a couple snapshots here from the state website. This is the New York Forward website. It's positivity rates for Chautauqua County. I have 2 charts. One shows the 7-day rolling positivity rate. So that's the first one here. Our 7-day rolling positivity rate for Chautauqua County, according to the state data, is 1.4%. And that's compared to the 14-day of 1.5%. And I just want to point out that the reason why we use this data instead of the county data, or why we don't report county data positivity numbers is because this is the state's data. This is the data that's going to be used to make the decision regarding yellow zones, red zones, orange zones. Any of the opening, closing data is going to be based on the data that the state is using. So that's why we try to drive people to these websites rather than reporting that on our own and causing additional confusion. So that's what I have. I can also tell you that today we will be reporting 32 new cases of COVID-19 in Chautauqua County.
All right, great. Thank you, Bree. Next, we'll go on to our director of, our public health director, Ms. Christine Schuyler.
Thank you, Ken, Executive Wendell. Thank you, everyone, for taking some time out today to be part of our town hall. I'd also like to reiterate messages that have already been there. We really must remain vigilant. I'm so proud of our county and all the work that everyone has done here in containing the spread, wearing our masks, washing our hands, social distancing, and doing the right thing for ourselves and for those who matter to us. Wanted to touch on a few things related to COVID-19, one of those being isolation and quarantine. I know there are a lot of questions at times about what is the difference between the two. Isolation is what someone will be ordered into if they test positive for COVID-19. And that isolation timeframe will be for 10 days from the date of your positive test, if you are asymptomatic, or it'll be for 10 days from the day that your symptoms started. Contact tracing will go back 2 days before your symptoms started, or 2 days before your positive test if you're asymptomatic. A quarantine is what someone who has been identified as a close contact to a positive case will be ordered into. That quarantine is for 14 days from the day of your last exposure to the person who was positive. That is because of the incubation period of COVID-19. So if you're identified, you're going to be contacted by a contact tracer, asked a whole lot of questions, and given a lot of education on what it is that you need to do in order to quarantine. Very important to know that you can't test out of quarantine. If you decide to go and get a COVID-19 test and it comes back negative, that's not a get out of COVID quarantine free card, because you still could come down with COVID-19 during that incubation period. That leads me to talk a little bit about the testing capacity within the county. As many of you are aware, we were able to hold rapid testing clinics on and off. We've been able to do that depending on the supply of materials that we receive from the state, and also honestly depending on our own resources between our department, the Department of Emergency Services, and staff who really are able to administer those tests and then do all the follow-up work that goes along with that. We currently do not have an overabundance of rapid testing supplies, so we have had to limit rapid testing, free rapid testing, to those who we need to test for investigative purposes, for our disease investigations, or because they are symptomatic and in quarantine, or even because they are an essential first responder or law enforcement officer or correctional officer, someplace where we really need to make sure we handle on any type of potential outbreak, and also be able to get students and staff members back to work who were symptomatic and need that negative test to get back to school. As testing supplies and resources increase, our goal is to increase the availability of free testing clinics again, and we will absolutely let people know when that time does come. This ties directly into the state's travel guidelines. There is still a 14-day quarantine requirement in place if you travel outside of New York State or travel into New York State from somewhere other than the contiguous states. So other than, for us especially, we look at Pennsylvania as our southern border. Other than that, there is a 14-day quarantine requirement. The governor's chambers came out with a test out option. That option is a little complicated though. That means you must receive a negative COVID-19 test within 72 hours of coming back into New York State. And then after you get here, you must quarantine for a minimum of 3 days and then receive a negative COVID test on your 4th day or after. If that negative test result, you get 2 negative test results, then you're able to test out of the 14-day requirement. I realize that there are a lot of college students who are traveling back for the holidays. We have still have families that are coming in and out, and a lot of requests for testing related to this travel quarantine. I guess our best advice is to try to plan ahead. There is testing available at the county various locations, the Chautauqua Center in both Dunkirk and Jamestown, UPMC Chautauqua outpatient, Westfield Memorial Hospital outpatient, and also WellNow urgent care centers are available. None of those areas offer rapid testing, so it will take a few days to get test results. So please take that into consideration. Also, always check with your insurance plan to make sure that you're going to have coverage for that test. There are definitely issues with insurance plans not covering COVID testing for people who are asymptomatic or have no symptoms of COVID-19. So please keep that in mind. I'd also like to touch briefly on zones. I know people are talking about what New York State has done with establishing microclusters and related to zones, and we're seeing a lot of things going on related to this with our neighbors to the north in Erie County. Currently, Chautauqua County does not have any zip codes or what we think are going to be zip code areas that look like we're heading even into a yellow zone at this point, which is very good news, and again goes back to all the diligent work that the vast majority of our population and visitors are doing to keep our infection rates low. If this occurs, then there are certain things that will happen within a yellow zone. Those things can be found on the State Health Department's website. The metrics that have to be followed to get us in that zone: Chautauqua County is a tier 3 geographic area. So that means we have to have a 7-day rolling average positivity above 3.5% for 10 days, and the geographic area has 15 or more new daily cases per 100,000 residents on a 7-day average. Yes, that sounds very confusing and complicated, and that's just the yellow zone. As Bree talked about, the State Health Department is who will be looking at those numbers, who tracks those numbers. We have no way to do it locally. So we really are relying on the state to let us know if it looks like anyone's getting close to being into a yellow zone. And unfortunately, if we get into a yellow zone, there are restrictions that will occur. It will impact our schools, it'll impact our businesses. Why it is so absolutely important that we continue to remain vigilant. We don't want our schools to have to go all remote. We don't want our schools or our businesses and non-essential businesses to have to close down anymore. So we all have a part to play in this. On the note of businesses, we've said this before, but I'd like to reiterate because we continue to get some questions. Just because an employee or a patron of a business tests positive for COVID-19 does not necessarily mean that a business has to close. That's where disease investigation comes in and contact tracing comes in. And along those same lines, there is no requirement anywhere for a business to have to itself report when they have a positive COVID-19 case, unless they are a long-term care facility. That isn't a requirement that they must notify family members that they've had positive COVID-19 within their facilities. In general, regular business, that requirement does not exist. There again, we go back to disease investigation and contact tracing. If you're deemed a close contact, you'll be notified by our contact tracers. In general, the only time we would reveal or go public with cases at a facility, at an employer, is normally in conjunction with that employer, and because we are noticing an outbreak, some sort of a spike, a cluster within that employer. Or another case could be if we're unable to do contact tracing and we really feel that there could be some risk. Fortunately, we have not experienced that in our county. We've had a lot of excellent cooperation from our residents as well as our businesses, our employers, and everyone involved. We do get a lot of questions on long-term care facilities, our nursing homes and our adult care facilities, especially with regard to visitation. I fully appreciate that it has been a very, very long time for many people who have not been able to see their loved ones. And I hope you can understand the state has put the rules and regulations in place that they have because the populations within long-term care facilities are very vulnerable to the complications of COVID-19. And because of that, we have to do what we can to protect them. At the local level, we have no say in the state's recommendations, their rules, their regulations regarding our long-term care facilities and their hospitals. I would fully encourage everyone who has concerns about that and would like to speak to the governor's chambers or their state elected officials about what the current policies are and have a discussion around, is there any movement on that moving forward? We have, since the beginning of this pandemic, the state declared a state of emergency. And when that happened, the governor's executive orders made pretty much null and void what we do at the local level. The state supersedes any local laws and rules and regulations. We really are going on what the state does. So that's why you haven't seen us issue a separate mask mandate or issue a separate business mandate, or the mandates have come down from the state. We are in line as a county in New York State following that. I think that was about it for my list at the moment. So, County Executive?
Thank you very much. We're going to turn it over to, we'd like to welcome everybody back, or actually welcome everybody we are now on Facebook Live. We were experiencing some technical difficulties on the end of Facebook as we came into this. So we'd like to welcome everybody and taking time throughout the day. We're just hearing from Christine Schuyler, our Public Health Director here in Chautauqua County. Previously, we also heard from Brienne Eggett, our epidemiologist here through the Public Health Department. We'd also like to let everybody know that the first part of this will be aired again on our Facebook pages at the conclusion of this live town hall. Next, we're going to move on to Dr. Burke, who is our one of our county health physicians here in Chautauqua County and former Public Health Director here in Chautauqua County. Dr. Burke.
Thank you, PJ. I'm going without video because I'm getting a lot of internet bandwidth signals here, so I'm trying to keep my bandwidth use down. I guess I'm here with a reality check. There's good news, there's bad news, there's all kinds of news out there, and I'm just going to try to sort through shortly. The good news is our positivity rate in the county is 1.5% approximately. That's phenomenal. When you look at what's going on in other places, 40, 60% is, again, social distancing, a great percentage of the population wearing masks and really doing what we have to do. The bad news is, if you look at nationally, the number of cases is skyrocketing. We're now in hundreds of thousands of cases. The good news is the death rate has gone from about 5 or 6% worldwide down to about 1 to 2%. And as Bree earlier, our death rate is in that range. That's great, but on 150 to 2, what we're seeing, and that's what we can expect to see. That's the bad news. And we really have to be careful about managing that. What does history tell us? Well, we know 1918, the Spanish flu came in 3 waves. An initial wave in September, October, November, December, then to 40-year-olds, and the last they've got the elderly. If you look at the waves in the summer, now we're spiking again.
Unfortunately, we've lost, let's come back on. Dr. Burke,
Yeah.
are you back?
I came back on. There's some interesting data from 1918, and then I'll quit because my bandwidth is awful here in Westfield. Two cities in the United States had two separate experiences. The city of St. Louis immediately put in a social distancing protocol, no church gatherings, no large gatherings, no public gatherings of any type. The city of Philadelphia did not, and both of them had approximately the same populations. St. Louis had 2,000 deaths during the epidemic. Philadelphia had 15,000 deaths, almost eight times as much. What we're seeing now is, if you look at Chautauqua County, who have been, I think, stringent in their adherence to mask wearing for the most part and really being very careful, we're running at very low positivity rates. You look out west at some of the rural counties now in North and South Dakota, they're running at 60% positivity rates. They did not institute mask wearing, whatever else. So here's the question for everybody out there. Do you want to be Philadelphia or do you want to be St. Louis? I would rather be with the experience that St. Louis had, where people just understood no social gathering, wear masks, be real smart about it, and really keep down your risk. We are looking at probably 4 to 6 more months of this until the vaccines come online. Dr. Walter will talk about that in a minute. Let's just hunker down. I know everybody's got COVID fatigue. I know this is not a lot of fun. I personally have been in quarantine for almost the whole month, having traveled to Colorado to see a grandchild, and then coming back, getting out, and immediately going back in, having come in contact with a positive case. It's not a lot of fun sitting at home, but it's a heck of a lot better than getting sick or making someone else sick. Let's be smart about this. Let's hunker down for another 4 to 6 months and get over this. We're doing a great job. Just keep your head down and keep doing it. Short-term mitigation process we have to continue. And it's simple. A mask, social distancing, wash your hands, be smart. Thank you.
All right, thank you, Dr. Burke. Moving right along, Dr. Walters, another one of our county physicians.
Thank you, County Executive. I just want to touch very briefly on some of the exciting news that came out this week about vaccines, which I'm sure a lot of you have seen already. There were some, in the last 2 weeks, both Pfizer and Moderna, two vaccination companies, released information about the effectiveness of their vaccines, showing 90 and 95% effectiveness against COVID-19, which is remarkable and even better than we had hoped for. Now, with that, you've probably seen in the news that there are some issues related to that. This is being done through a different process than typical vaccines that we see. And because of that, and because of the stability of the vaccine, I won't go into the science and bore everybody, but because of that, they do require some extremely cold temperatures to store these vaccines. And so we're talking minus 94 degrees Fahrenheit for one and minus 4 degrees Fahrenheit for the other. So as we look forward to having these vaccines widely available, that will pose some challenges for how we distribute the vaccines and how we can transport and store them and their shelf life and things, but very, very encouraging information coming out. Both vaccines require 2 doses, usually about 28 days apart. And so that means that even if we start ramping up production like they're expecting to produce 20 million doses a month, that still only covers, 20 million doses only covers 10 million people. And if you think about all of the people across not just the United States, but the world, we need a large amount of vaccine to get to the point where we have everybody vaccinated and get to the herd immunity that we've been talking about for months. So even when these final approval processes all come down the line and when we have it available, it's still going to take us time to get that vaccine delivered to everybody, every one of our people in the community. And so with that, we need to remember to, continue our social distancing practices, wearing masks, and that becomes so important. We've done such a good job, like Dr. Burke mentioned, of keeping our numbers down thus far, and we need to continue that going forward. Now, the vaccines so far, they're still in ongoing clinical trials. They're still being monitored very closely, but They haven't really had any serious side effects to date. They have noted participants have had some, injection site soreness from the vaccine, like you would with any vaccine, and a little bit of fatigue, joint muscle aches that last for a day or two. But those are typical, like we see with any vaccine, including the influenza vaccine we're all very used to. Otherwise, they seem to be very safe and effective. And the other encouraging part is because of using the messenger RNA model for delivering these vaccines, a different type of technology, there are some thoughts that these will be safer and not have the other side effects or more severe complications we sometimes see with other vaccines. So that's all excellent news. Since I mentioned a second ago, influenza vaccines, now is also the time that we start to get into influenza season. We are starting to see cases of influenza slowly starting to come into the region here. And we haven't, really gotten to the peak of that season yet. But I want to remind everybody the importance of getting an influenza vaccine. You hear in the media about people talking about the twindemic, or that, having both influenza and coronavirus occurring at the same time, which puts even more strain on our healthcare systems, emergency rooms, hospitals, doctors' offices. It increases our PPE use and puts a whole burden on the system, all those things that we're trying to preserve through flattening the curve and that. So we really need to all do our parts to make sure we get our vaccinations. And the other part of that is that the symptoms, I think we all know the symptoms of coronavirus are very nonspecific and overlap a lot with influenza, right? They both cause this flu-like illness, which can have a whole myriad of symptoms. If you get the influenza vaccine, it's one less thing to worry about. One, you're going to be protected and less likely to get influenza, and two, then it helps us to weed out, whether the symptoms are from coronavirus or whether they're from influenza. So I really want to encourage everybody. We say it every year, but this year is even more important to encourage everybody across the community to go out and get their influenza vaccine. That being said, I know it's going to be quite some time. We're looking for these vaccines before we can have them mass distributed. It may be 6 months. It could even be longer into the middle of next year before we can get them out to everybody. I know that the County Health Department has already been working closely in conjunction with the State Department of Health in developing plans for mass distribution, and the county will follow the guidelines put out by the state as those things come down the pipeline. Christine, I don't know if you have any additional information or you want to say anything else to that point?
Sure. Thank you, Dr. Walters. As the County Health Department, we do have as part of our public health emergency response preparedness plan, a pandemic COVID-19 vaccination implementation plan. The State Health Department did provide us with a template. Our plan was due to the state by close of business Monday, which we did submit that plan for state approval. And that runs down through everything from vaccine storage to the implementation of what we call pods, or point of dispensing clinics. We're looking at mass vaccination in a way that has never been looked at in this country before because of the scope. There's still a lot of unknowns out there, as Dr. Walters discussed, with vaccine storage and how we really are, the devil will be in the details when this is worked out, but we do have a framework of our plan already put together and submitted. The main crux of our plan will be drive-through vaccination clinics for COVID-19. So I would like to reassure everyone that we are well down the road in a planning stage for when the federal government and state government rolls out the vaccine to us at the county level.
All right, thank you. Moving on, we're going to talk next to Dr. Michael Falk, another one of our county physicians. Dr. Falk.
Thank you. I wanted to briefly review the clinical presentation of COVID-19 and general hospital management, and maybe touch on some of the treatments that might be on the horizon, keeping in mind that the county really does not direct, treatment, per se. This is really driven by individual hospitals in hospital systems in our county. But my first point is an important one. If you're having a medical emergency, by all means, we want you to get to the closest hospital or dial 911. I have personally witnessed patients in the emergency department setting ignoring symptoms such as chest pain or shortness of breath or stroke symptoms and other serious symptoms for several days prior to coming into the emergency department for help because they were afraid of contracting COVID-19 at the hospital. I can say confidently that our local hospitals have policies and protocols in place to protect you. However, on the other side of that coin, we know very well that most patients with COVID, especially those who are younger and have no serious health problems, will typically have mild symptoms. And if you're having mild symptoms, I would recommend speaking with your primary care physician, discussing at-home treatment for symptomatic relief, and also discussing testing options while self-isolating as discussed earlier today. You know, the typical presentation of COVID-19, as most of us know by now, is similar to other respiratory viral infections. Symptoms such as cough, body aches, sore throat, headache, nasal congestion, extreme fatigue, and chest pain. You know, we've heard a lot about the loss of taste and smell that seem to be more unique symptoms of COVID-19. But I've also noticed, and this is also published in the literature, that some individuals are also experiencing gastrointestinal complaints, such as nausea, vomiting, diarrhea, and abdominal cramping. I do recall diagnosing one patient that had symptoms only of nausea and vomiting and without the cough or other respiratory symptoms. So we all have to be vigilant about those atypical symptoms of COVID as well. While most of these cases will be self-limited and just requiring symptomatic treatment at home, we clearly know that some folks will have worsening of their symptoms and will need hospitalization. Overall, there is no specific cure for COVID-19, sort of like there would be for somebody who is diagnosed with an ear infection, needs an antibiotic, and the ear infection clears up. Patients at most risk of decompensating, and we've heard a lot about this, but I think it's important to reinforce, especially coming into the holiday season this year, is that the patients most at risk for decompensating and having bad outcomes from COVID-19 are those with advanced age or other health problems such as diabetes, high blood pressure, heart disease, and obesity. A history of smoking and underlying lung disease such as COPD, which includes things like emphysema and chronic bronchitis, also seem to be risk factors for worsening disease as well. If somebody reaches the point of needing hospitalization due to COVID-19, it is typically because blood oxygen levels are very low, secondary to lung inflammation. Other reasons for hospitalization may be someone that is in need of hydration, perhaps because of excessive vomiting or diarrhea, and unable to stay hydrated at home. Treatment in the hospital is generally conservative, with physicians employing supportive care as there really, again, is no single approved cure for the virus. These treatments may include things like oxygen, times high flow oxygen, IV fluids for dehydration, sometimes antibiotics if there's a concurrent bacterial infection, but antibiotics are not standard treatment for COVID-19. Steroid treatments such as IV dexamethasone have become part of the standard and accepted treatment for hospitalized patients. It is known that patients with COVID-19 are more susceptible to developing blood clots, and therefore most hospitalized patients will receive some form of anticoagulation, essentially to thin the blood to prevent blood clots in the lungs, the heart, and the legs, which are the most common places where people develop blood clots. Some of you may have heard of antiviral medications such as remdesivir. These types of medications, like remdesivir, may be administered. I think it's important to point out right now that remdesivir has been shown to decrease days in the hospital and may help get patients off oxygen sooner, but overall it has not been shown to improve overall mortality. In other words, remdesivir has not been shown to reduce deaths from COVID-19. Remdesivir did obtain FDA approval for treatment of COVID at the end of October, and more hospitals are starting to use remdesivir. Other medications hospitalized patients may receive are things like vitamin D, vitamin C, and zinc to help augment the immune system's fight against the virus. And in very limited settings, and not so much in our region, as of quite yet. Again, this is more in larger academic settings. Convalescent plasma has been given to help treat the viral infection. A lot of us have heard about convalescent plasma in the news. It is basically a blood product donated from someone with known COVID antibodies following a previous COVID-19 infection. Convalescent plasma at this time has received emergency use authorization, but has not been approved by the FDA and is mostly investigational at this time and is not part of routine COVID-19 treatment. And to be honest with you, is really generally reserved for the academic setting and really, really sick individuals. Some of you may have seen monoclonal antibody treatments in the news recently. Monoclonal antibodies are antibodies that are developed in a laboratory setting and are designed to identify a certain type of antigen on the coronavirus to facilitate neutralizing the virus. There may be several companies developing monoclonal antibody treatments at this time, one of which is Eli Lilly. Eli Lilly has received emergency use authorization for treatment of COVID-19. And tentatively, this medication may be used in patients who are at high risk for COVID-19 complications, but not yet hospitalized. The idea with this medication is to prevent patients with risk factors, advanced age, and medical problems from decompensating and actually requiring hospitalization. So in some very limited settings where hospitals are using this, it's really done on an outpatient basis on those patients who are at really high risk of developing complications. But similar to convalescent plasma therapy, monoclonal antibody therapy is not routine and largely limited to larger academic type settings and is primarily investigational. Certainly more research is needed with both convalescent plasma and monoclonal antibodies to determine the true benefits and risks of these treatments. And in conclusion, as someone once said, an ounce of prevention is worth a pound of cure. Taking the standard precautions, as we've discussed today, including masking and social distancing and good hand hygiene, and overall really, good decisions in regards to the upcoming holidays, those are always the first steps. Additionally, and I'll throw this in there, paying attention to our own health to help prevent bad outcomes from COVID-19. This is kind of a whole different topic for a different day, but things like focusing on sleep quality and quantity, avoidance of processed foods and excessive amounts of sugar, getting more whole foods and such as vegetables and high quality meats into our diet, smoking cessation, and just getting some fresh air and physical activity can go a long way in helping maintain a healthy immune system. So thank you for your attention. I appreciate that.
Thank you. And now we're going to turn our microphone over to our Senior Director of Emergency Services, John Griffith.
Thank you, Mr. County Executive, and thank you everyone for the opportunity. At first, I'd like to thank the first responders in Chautauqua County who've done an excellent job in taking care of the people who are working with COVID and the people we've had to transport and work with on an emergency basis. One thing I can say about the first responders is we've been extremely fortunate in Chautauqua County, and it does show that masks and proper PPE and things like that do work. So if anyone questions masks and whether or not you should wear a mask, please do so. That really does make a difference. It's kept our first responders safe, and it will continue to keep them safe going forward. So we're real lucky to have the people we do here. Thank you for everyone out there, and please wear a mask, save a life. Thank you.
Thank you, John. At this time, we're going to start with our questions and answers. Some people have already submitted questions that we will read, and then different members of the panel will answer them, and then we'll get through any new ones that do occur. But first off, this question was asked by Christina and Christina C. Would we consider putting temporary measures or ordinances so when individuals are in public settings and when in all businesses in the county that everyone would be required to wear a mask at all time except for those with valid health reasons or who are unable to wear them? Also, would the enforcement of this mandate be enforced by police officers, elected officials, etc.? One of the things we have stated from the very beginning is on Executive Order 202.3 that was issued on March 7th of this year. Governor Cuomo also said local municipalities cannot issue separate or differing regulations, those, if we decided to put in a differing regulation, which there is already a state mandate for wearing masks when in public or unable to socially distance, the governor would then have to approve that additional regulation. Since that is there, highly unlikely that the governor would add another one if this is already a mandate. So those things are being asked and considered on a per diem basis, as do many of the counties statewide have not added. Some have, and very specific to situations that arise in their counties, but to add on to the governor's already existing mandate would not likely get approval. Moving on, Debbie had asked a question related to the nursing home regulations, difficulty that family members face if they have a loved one in a nursing home who they cannot visit. Christine, would you like to answer that?
Yeah, especially since we talked about this before we were able to go live, and we truly empathize with everyone who's got loved ones in long-term care facilities and have been able to visit them for such a long period of time. I hope that people can try to appreciate that the state has put these rules and regulations in place as a preventive measure. Those in long-term care facilities are some of our most vulnerable when it comes to the complications related to COVID-19 infection. And in an effort to protect them, the state has come out with the guidelines that are currently in place, including visitation requirements, which are pretty extensive. A couple of the big things there is a family member must test negative within 7 days of visiting. And if a staff member or resident tests positive for COVID-19, that resets that visitation clock for 14 days. And that is really heartbreaking for many, many people. At the local level, we have no authority over long-term care facilities or hospitals. Those facilities are regulated by New York State Department of Health, and these rules and regulations are coming from the state. At the local level, we really would encourage anyone who takes issue with the regulations or would just like to have their voices heard, please contact the governor's chamber as well as your state elected officials to try to get some movement on some of these things at the state level.
Thank you. Michelle had asked a question about information on social media. If the county monitors the pages and sees the people and what they are posting. Also stated minimizing and laughing at the illness or fatalities or posting conspiracy theories are not helpful. You know, we need to be very diplomatic when we talk about this in social media, as that, you know, we need to be understanding of everybody's position. We need to trust what the officials and health departments are posting and not so much what our individuals may be posting themselves. Obviously, we do have a freedom of speech and we're not censoring pages except for vulgarity, but we like to remind everybody that a lot of things can be posted on social media. The truth and the factuality of those posts may not always be substantiated, but I can, again, and from this group, many of them are on our COVID response team. I tell you the information that does come out is valid, it is transparent, and we do not change or alter anything that goes out. So when we post things here from our county, those are factual, and we like to make sure we reiterate that. Lori has asked a question. What is Chautauqua County's plan now that we're seeing clusters and increased cases here when we are so different from other areas in the state? Christine, would you like to address that?
I think our plan is to stay the course. Our staff has done an excellent job of very timely and efficiently being able to isolate and quarantine positive cases as well as those who have come in contact with positive cases. That really is key to decreasing the spread of COVID-19. We will continue to do that and focus in when we do see clusters. I think it's important for people to understand that many of the clusters that we are currently seeing are family members. They're people who live either within the same households or are in an extended family who have either been together at various gatherings, or we have a few cases now of weddings that have spread COVID-19 like crazy through families, and some people being very ill. So this comes back again to that personal responsibility and accountability and taking care of yourselves and your loved ones. Even as far as going out when you're in a social setting, or you go out for dinner. Yes, the restaurants and such have protocols in place. You can take your mask off when you're seated at your table. That doesn't mean you should. It doesn't mean that you have to. It's in your best interest to try to keep your mask on as much as you can. And that will definitely help to decrease the spread of COVID-19 and influenza and a lot of other things we've got around here.
All right, thank you. One question that's come in from Todd and Tanya. They're asking, is there any data or concerns about the long-term effects or side effects of the vaccination? Dr. Walters, would you like to address that?
Sure, and I think that's a very good question. I think one that a lot of people have on their minds as we look forward to having the vaccines available. To this point, we don't know of any long-term side effects or any significant issues with the vaccines. Now, granted, these are still new, and that's why they're still being studied. And those studies, it's not that people are just getting the vaccine suddenly today. These have been going on for several months. So we do have some data available, but they are still new vaccines. Because they work a little differently than the traditional vaccines, like I mentioned before, there is a theory that they should cause less side effects because it uses your own body to produce the type of spike protein that your body produces antibodies to. So they're thought to be safer than even our normal vaccines, which we use, but this is still something that we're looking into. All that we know right now is that the side effects we've seen are very minimal and very similar to previous vaccines, with some injection site soreness, muscle aches, a little bit of fever, headache, things of that nature. And while we focus a lot on the Moderna and the Pfizer vaccines, and I talked specifically about them before, there are still several other vaccines that are made in a more traditional way that are still undergoing trials and may be available in the future as well. So we'll have to keep a close eye on all of those vaccines and any other health issues or side effects that do come up down the road. But as of right now, we don't see any of those issues presently.
Excellent, thank you. A question that came in, Jane has asked why contact tracers ask, what race do you identify with? And how is this information relevant to the containing the spread of the virus? Bree, would you like to answer that?
Sure. So at the beginning of the COVID-19 pandemic, especially in urban areas, we saw that ethnic and racial minorities were more likely to contract the virus and to face severe disease as a result of the virus, as well as death. And so it's always very important when we're doing disease investigations to track that kind of information, because it tells us what communities are being impacted by the virus. It helps us to understand, to reach out to those communities, provide education and support, understand a picture of what's going on in our community, and provide preventive education and support to the community. So I hope that's sufficient.
Excellent. Franklin and Kevin both asked, the county has not enforced, why has the county not enforced wearing a mask, especially in businesses? They've been to some businesses who enforce and other ones who do not. One of the things we do is enforce the mandates coming from the governor. All complaints are followed up. If you would like to submit a complaint to the New York State Pause Task Force, there are two people that get those complaints. That's myself and Sheriff Quattrone. We do get those out to the proper law enforcement jurisdictions and make sure that they follow up with the business. But what's really important is if you would please give your name and contact information when reporting. This is kept extremely confidential, and it will also be more effective that we can follow up with that person on the complaints that they register. Some businesses do enforce more than others, but we do, when we get those complaints, we do get them out to the law enforcement agencies, and directly those law enforcement agencies speak to the businesses in question. Also, we reach out to individuals if those should arise. Christine, would you like to add something?
Yeah, the more recent executive orders from the governor's chambers have made it possible for enforcement to happen through the state sanitary code. We do have several enforcement actions pending that we will be handling through our public health law process with the sanitary code and the Board of Health. Our staff, especially in environmental health, are actively enforcing the restrictions, the guidelines that are there, especially as pertaining to any establishments that we permit, such as restaurants. of hotels, anything like that, and any complaints that come in where our staff seem to be the most appropriate to investigate the complaints. We can't always respond, as the county executive said, because some things come in on an anonymous basis. But we are actively enforcing. It has been all hands on deck since the beginning of this, and it continues to be that way. And we will be actively enforcing guidelines throughout this holiday season.
Thank you. A question came in. Carrie had asked, they know that the Jamestown Public School District will be going remotely only the weeks after Thanksgiving and Christmas breaks. Does the County Health Department recommend other districts do the same? And second part to that, it would also be great if the county would report a positivity rate on a 7-day positivity average on a daily basis so citizens can better understand the criteria for decision making. Christine, would you like to address that?
Yeah, as far as the schools go, we are working closely with our partners in the school districts. We have public health nurses who and our school specialists who work very closely regarding cases and close contacts. I'm working with the school superintendents to figure out how we can support them in the very best way that we can with the school zones, and if we were to go into a yellow zone regarding testing requirements in schools. As far as whether or not schools choose to go remotely or close down, if they're not within a yellow, orange, or red zone, that is a decision of the school. This seems to be handled on a district by district basis. We really are not making any blanket recommendations. I really have been thrilled so far to see that we have not had spread within our schools where there's been in-person learning. The cases that we've really seen amongst our school students and school staff have been related to activities outside of the school. So we go back again to that social circle, keeping that social bubble small and abiding by the guidelines when you're not at school or you're not at work can really help to decrease the spread within the schools and then obviously within any businesses as well. I talk quite frequently with school superintendents and officials, and a case-by-case basis on this. I did speak with Jamestown Superintendent Whitaker about the decisions that they were making as far as going remote. I could understand basically the rationale that they were using to make that decision, and we do the best we can to support the schools through this entire pandemic. I think Bree is best positioned to answer about the positivity rates and posting that. Bree?
So we don't post our own positivity rate on a daily basis, which would be the number of cases the positive cases we're reporting divided by the total number of tests that have been done within a day. And the reason we don't do that is because New York State does that on the New York Forward webpage. There's a positivity dashboard which you can view, and all the decisions that are made at the state level regarding microclusters and openings, closings, those kinds of things are made using the state's data. So that's the data that should be referenced and not our local statistics, because that is not something we have the power over. The positivity dashboard is pinned on our Facebook page. The very top post has a link to the positivity dashboard, and that can be viewed on a daily basis for anybody who's interested in taking a look at that.
All right, thank you. Another question that's come in from Gina, Chris, and Kim. They all ask if Chautauqua County headed for an orange or red status soon, or generally people are asking if and when we will be shut down for the county. And if so, who declares this, the governor or local officials? I can tell you that any declaration of a microcluster or going into a red, yellow, or orange zone is done by the governor. That does not come with any information or discussion with the local municipalities. That will be made solely at the state level by the governor. One of the things we have discussed at great length, and I brought this up on yesterday's control room, is that is there a potential we could go to a yellow, let's say, for example, if Erie County goes into an orange zone. What's unique about Erie County is there's such a large number of geographic areas in the yellow zone. It makes it look as if the entire county is a yellow zone. But the idea behind the microclusters is just that, to identify geographic areas and to deal with the micro clusters. Micro clusters are abundant in Erie County. But having said that, that does not mean because we border Erie County that if they go to orange, we therefore go to yellow because we border them. That decision will be made based on the statistics and the numbers in those geographic areas within Chautauqua County. Presumably they are our zip codes. So at this time, we do not see Chautauqua County entering those areas. As you see, Erie County's positivity rate is 5.6%. Ours is 1.4%. So again, actually, I think Bree touched on 1.87%. So we are much lower than Erie County. But again, the question remains is, could we get there? Certainly. If we are not all working together and continuing the hard work that we've done thus far, yeah, we could be there. But the reason for this messaging today and just reaching out to everybody is reminding everybody we're doing a good job and we need to keep doing it. But if we slip, if we decide to let off the gas, then we could easily see ourselves there. So we want to remind everybody as we move forward. Brian asked a question. A lot of experts are talking about not having holiday gatherings. What are our thoughts on that? I could say personally, and we'll allow others to chime in. From a personal standpoint, this is our personal responsibility to our families. Do we need to have a large gathering of 30 to 40 people? I've seen friends line tables up from the living room through the dining room into the kitchen. 40, 50 family members around sharing the holidays. That may be a long-standing tradition, but we need to keep this in mind that we are not sure. Sometimes people don't realize whether they are positive. They could be asymptomatic. And if you have a family gathering of 30 to 40 people without wearing masks, all of those people would therefore be in your contact. So you jeopardize the health and safety of all of your family. So we remind everyone that those large groups, and the governor has stated, currently there are no more than 10 at family gatherings. I'd just like to remind everyone, please use some good common sense and responsibility when dealing with that. But as far as canceling the holidays, unlikely here in Chautauqua County.
Would it be okay if I added to that, PJ?
Certainly.
So I just want to say that in public health, we typically take a harm reduction approach. And while the guidelines say not to gather, we know that people are going to gather. And so what we want is for you to be as safe as possible. Have a plan. Right now, there's 9 days until Thanksgiving. This virus has an incubation period of up to 14 days. Now's the time, if you're planning to gather, to lock it down. Don't go out and hang out with your friends. Don't be doing things that you wouldn't otherwise be doing. Make sure that you wear a mask when you go out of public. Sanitize frequently. Stay safe.
Excellent. Thank you. All right. One last question. We're wrapping up closely here. Alex had asked, why is there such a large disparity between the total testing numbers given from the Chautauqua County map and the numbers on the New York State dashboard? They can understand minor differences, but it seems the county's reporting is almost half as many tests. Christine and Bree, would you like to answer that?
So the data that you see on the state's website is a raw number that comes from the state. It's a basic how many tests were done, how many tests were positive. When we take a look at those numbers and we report numbers, the data is more clean. So it has to do with the cleaning. In some cases, the cases are transferred to other areas. For example, if there's a college student who is attending college within the county, they've been tested here, they listed their address here, and perhaps they're isolating and they're actually from Erie County. So that case is going to be transferred to Erie County and not counted in our numbers, whereas it's going to be counted in the state's numbers. Additionally, timing is a factor. The state looks at any tests that are done from 12 a.m. to 11:59 p.m. and a calendar day, and they report on that for a daily figure. Whereas our numbers are slightly different. We report what we have that's either left over from the prior day until about noon on the day where we're looking at those numbers, and we have case interviews. So our data is a little more recent, a little more real time, and more clean. So the other thing that I'd like to mention is that periodically the state updates their system. And there was an incident on Saturday where they updated the system, I believe, the state's system said we had 5 cases in Chautauqua County on Saturday, and we reported, was it 20? I believe 20 on Saturday. So there's a big difference there, and that's because the state shut down their system that was tracking that at 2 o'clock and didn't record any of those deaths that happened after 2 p.m. And those, I believe, were added to the next day. So it has to do with timing. It has to do with transfers, cleaning, and system updates. As far as the testing, we honestly don't really know exactly how the state is doing their numbers, and it's not necessarily even from the State Department of Health. It's coming from the governor's office, and we don't have all of those details. So we can't answer the question about the number of tests and why those are so drastically different.
Excellent. Another question has come in from Ginger. They're asking about the individuals who need a negative test to return to, a negative test result in order to return to work. If the person continues to test positive, are they considered contagious after each positive test, even if their symptoms have subsided?
I can take that one. In general, the CDC recommends that anyone who tests positive for COVID-19 not being tested for 90 days after that. There are some people who will continue to test positive even after the infectious period of about that 14 days. And we call them persistently positive because they can continue to have some virus that shows up on a test, but they are not infectious any longer. It's up to the employer if they determine they want a negative test for someone to return to work. The long-term care facilities, they do have to have negative tests to return to work, and that is a state health department requirement. In general, as a county health department, we are not recommending that of employers locally because we use the symptom-based release from isolation and quarantine, which means basically you've served your time, the infection period is over, your symptoms have improved, and you can be released from isolation or quarantine. And a positive test result could just mean some of that residual virus showing up on a very specific test, but they would not be contagious anymore at that point.
All right, thank you. Okay, well, we haven't seen any new questions come in a while. So at this point, we're going to wrap up our Facebook town hall. We would like to remind everybody that we have gone over our statistics for today. As Bree announced, there are 31 new cases here in Chautauqua County. Also, we are sad to announce another fatality here in Chautauqua County, bringing that total now to 16. Tomorrow we will have our daily video coming from my office, and we will touch on those zip codes. And we would also like to share our condolences. Our 16th fatality was a gentleman in his 90s with multiple comorbidities. So again, our heartfelt condolences go out to him and his family, again, as we enter the holiday season. We would like to remind everybody that, as we said before, we are in this together. We have done a tremendous job here in Chautauqua County, and we need to keep up the good work. You know, we really look at this from a statewide perspective, and throughout the state, also throughout regional dashboards, if you happen to find us, Chautauqua County remains one of the lowest. And that is also because of the work of not only our team, but also the residents. You are the ones out there wearing the masks. You are the ones socially distancing. You're the ones doing what we're asking you. If there are some of you who question whether we should or should not, I think you need to look at your family members if you meet this holiday season and ask yourself, are you doing as much as you can for them? I travel to work every day and I see a billboard that says, our heroes took care of them. Now it's time for us. Our heroes took care of us. Now it's time for us to take care of them. And I use that throughout a lot of different meetings because our elderly population have always taken care of us, whether it's parents, grandparents, aunts, or uncles. It's now our turn to take care of them, to take care of our residents, to take care of our families, to make sure we limit the spread of this disease as we have done here in Chautauqua County. We're not without any sort of impact, as we've seen and as we announced another fatality today. But through our efforts, we will continue to be a strong county and continue to be CHQ strong throughout this entire crisis. I would like to thank everybody, my entire COVID response team, for taking part in this. I'd like to thank all of our residents for sharing your questions and concerns with us. Look forward to seeing you again. For all of us here on my COVID-19 response team, thank you and have a great evening.